Being poor can really hurt a person's health and affect how they use the NHS here in the UK. Right now it's thought that over 1 in 5 people are living in poverty. Poor people often get sick more, have trouble getting healthcare, they get treated later and end up in a worse condition. Poverty affects their health every step of the way. But it doesn't just affect people personally, it also costs the NHS a lot of money. In 2016, the Joseph Rowntree Foundation estimated that poverty added an extra 29 billion to healthcare costs, which would be 34 billion in today's money. Things have got much worse since that report. More people are living in poverty now, and even more of them are in deep poverty. Living in poverty makes it hard to stay healthy. For example, eating healthy food, well, that can be quite expensive. When people don't have much money, it's tough to afford a good diet. If you get a chance at the end of watching this, please check out a video I made recently on this very subject about malnutrition in the UK. The link is on the screen. Poorer families often lack cooking facilities. 8% of families earning less than £10,000 a year don't even have a cooker, and 16% don't have a freezer. Quite alarmingly, poorer areas have more fast food outlets. Nearly 1 in 3 food places in the poorest areas cater to fast food, compared to 1 in 5 in richer areas. It's not surprising that being poor often leads to a poor diet. Since a bad diet can cause health problems, it's also expected that people in poverty have more diet-related health issues like heart disease and diabetes. Being poor can hurt health in other ways too. For instance, poor people often live in unsafe or unhealthy homes and struggle to heat them properly. Poverty can also lead to mental health issues because worrying about paying bills, buying food and finding a good place to live, well, that's really stressful. Now, whilst I still have your attention, could I ask that you hit the thumbs up button for me and subscribe to the channel if you haven't already? Thank you very much. Now, these issues existed even before the cost of living crisis, but the crisis has made these things so much worse. More people are unsure if they'll have enough food, and a 2023 survey showed that 25% of the poorest households are eating less fruit and vegetables because of higher costs, compared to only 8% of the richest households. Rising energy bills are also adding to the problem. These issues have led to a rise in extreme poverty. In 2021, leading into 2022, 6 million people were extremely poor, up from 4.5 million 20 years ago. About 3.8 million people face extreme poverty in 2022, which is 64% more than in 2019. For these people, the health impact of poverty is even worse. Another change is the increase in 0-hour contracts and unstable jobs. This can also hurt health. There is a 12% difference in self-reported good health between people with secure jobs and those without. Childhood affects health for the rest of a person's life, and growing up in poverty makes it worse. Bad experiences during childhood, often linked with poverty, harm health later on, increasing the risk of serious diseases like heart problems and cancer. Children in poor areas face health issues early, such as higher rates of obesity, more exposure to places that sell tobacco, and worse mental health. These problems affect kids' health now and later in life, which also puts more pressure on the NHS. It can create a cycle where children in poorer families have worse health. This can limit their chances in school and work, keeping families stuck in poverty for generations. Also, if a child gets sick, it can push a family into poverty. For instance, parents might have to stop working to take care of a sick child, leading to less income coming in. It's very worrying that more children are now living in poverty. Deep poverty has also increased a lot, with 1 million children living in extreme conditions in 2022, which is 88% higher than in 2019. Now, compared to other rich countries, the UK has seen the biggest rise in child poverty. Now, understanding poverty isn't always simple. It's easy to see that being poor can lead to more illnesses, which means more people need help from the NHS. But it's not always that straightforward. For example, people in poorer areas drink less alcohol overall, but they are almost twice as likely to go to hospital for alcohol-related issues. We don't know exactly why this happens. If you have an opinion on this, please share it in the comment section down below. This backward link shows that the connection between poverty, illness and the NHS can be complicated. Even if fewer people get sick, the NHS might not necessarily get less busy. There are many factors that influence poverty and health, like where someone lives, their age and their ethnicity. This is even harder for people in multiple disadvantaged groups, as their different social problems can combine and make their health even worse. Poverty among NHS workers is a big and growing problem as well. Over 70% of NHS providers says that many staff struggle to afford travel just to get to work, and about 40% say staff can't even afford to eat at work. This makes staff unhealthy, leading to more sick days. Finding and keeping staff is also hard, with nearly 70% of providers noting that staff are leaving for other jobs due to high living costs. Besides their own poverty, NHS staff often see how poverty affects their patients. This takes a toll on them emotionally because they can usually only treat the symptoms, not the root cause of the poverty. Poorer people often have more health problems, so you might think they'd use the NHS more. But that's not always true, especially earlier on when they need preventative care. There are two main reasons for this. Poorer people often face obstacles that stop them from seeking treatment. Maybe they can't afford transportation, or they worry about costs. Or sometimes the NHS doesn't have enough resources to reach these people or provide the care they need. For people living in poverty, getting healthcare can be quite difficult. Phone wait times can be long. Just to book a GP appointment, they might not have the internet at home, which makes online services hard to use, or they might not be able to afford NHS fees. Besides these issues, poverty often brings a stigma. People might feel embarrassed or ashamed, making them hesitant to seek treatment or other help like financial advice. Unfortunately, there's also a lack of trust in public services, which include the NHS, among poorer communities. This distrust can make people even more reluctant to seek care. These factors mean that just improving how services are accessed won't solve the problem. The NHS has to find ways to address these deeper issues too. For many people stuck in poverty for generations, there's a belief that public services like the NHS just won't help or understand them. They think these services are pretty much useless for their needs. For example, if you live in one of the poorest areas in England, you're twice as likely to wait over a year for non-urgent treatment compared to others. This is an example of the inverse care law, which means that people who often need healthcare the most often get the least of it. In poorer areas, there are fewer doctors available for each patient. Appointments are shorter and patients don't get to see the same doctor as often. This affects how happy patients feel with their care. For instance, in 2023, 80% of patients in the poorest areas felt that they had enough time with their doctor, compared to 87% in the richest areas. Dealing with the NHS can be more complicated for poorer patients. Senior NHS staff mentioned problems like complicated forms to get travel expenses reimbursed, which assumes people can afford to pay travel costs up front. Only 61% of people aged 65 and over are happy with how they access services when they need them, compared to 69% in richer areas. You're more likely to have unstable housing and move around a lot. This makes it hard for your local hospital to have your contact details. A senior leader in the NHS mentioned this very issue. It's important to understand that just giving more help to poor areas won't fix everything. Poverty itself makes people sicker and puts more pressure on the NHS. Even if the NHS had more capacity and funding to help, solving poverty is a bigger issue that goes beyond healthcare. People are less likely to use preventative health services. This includes things like cancer screening and child vaccines. The same pattern is seen in other communities or non-urgent health services. In 2022, a survey showed that people aged 65 and over from lower social grades had fewer dentist visits, GP appointments, and non-urgent hospital visits. This happens even though they are more likely to have long-term health conditions. The cost of living crisis is making things worse. In 2023, 8% of low-income adults said they didn't get their prescription or other medicines because they couldn't afford them. Also, 19% said they skipped important dentist care. Now, this problem might get even worse because more healthcare is moving online. Poorer groups, who often can't afford the internet, can find it hard to access this digital care. And as a side note, more than 1 million people cancelled their broadband last year. If people can't get the services they need on time, they could get sicker, needing more expensive care. Poorer people often find it harder to see a GP and end up using other services instead. In 2021, the rate of undiagnosed diabetes was twice as high in the poorest areas compared to the richest ones. A recent survey showed that among the poorest people whose health got worse during the cost of living crisis, only 33% had used mental health services and 39% had used physical health services. There were various reasons why they couldn't get the care they needed. The NHS has a challenge. It needs to find people who aren't getting the healthcare they need and make sure they get the right treatment. If people get care earlier, there's a short-term increase in demand, but this can reduce the need for more expensive treatments later because early treatment is often easier and cheaper. Poverty makes people sicker, so they need NHS services more. However, poor people also have a hard time getting care earlier on. This means they wait until they're very sick, which costs the NHS more money and leads to worse health outcomes for these patients. For an example, let's talk about dental care. Now, as we've already said, eating healthy is harder for people living in poverty, and this leads to more tooth problems like decay in poorer areas. Recently, the media has highlighted how hard it is to find NHS dentists, especially in these same areas. NHS dental charges, which range from just under £26 to £307, adds another hurdle. Together, these issues result in much higher tooth extraction rates for people in poorer communities. To understand the cost, consider this. A general visit to the dentist costs the NHS about £192. However, a major surgical tooth extraction in a hospital can cost £3,915. If people get dental care sooner, it costs less and is better for their health. Unfortunately, the situation has worsened. From 2018 all the way up to 2022, routine dental checkups for adults who don't pay fell by 47%, but urgent dental care treatment rose by 14%. People from poorer areas also go to A&E more often. In fact, in 22-23, they went nearly twice as much as those from richer areas. Poorer people spend more time in critical care, which is one of the most expensive types of hospital care. It costs the NHS over £2,000 per bed per day. People living in poverty often wait until they get really bad before they go to the hospital. They end up needing emergency care more often and staying longer in critical care. This delay not only worsens their health, but also costs the NHS so much more money. Treating them earlier will be better for their health and cheaper for the NHS. Unfortunately, poverty does make it hard for people to stay healthy. Those living in poverty struggle more to get NHS services, they have worse health, and unfortunately they die younger than rich people. The growing number of people living in deep poverty, combined with higher living costs and more pressure on NHS services, makes this problem even worse. More children are living in poverty now, which hurts their health in the long run. NHS staff see the effects of poverty both in their jobs and, unfortunately, in their own lives. So people in poverty often wait too long to get medical help because they can't afford it, which leads to more emergency visits and hospital stays. While the NHS is trying to make its service better for people in poverty, the government needs to step in and tackle the underlying causes of poverty and improve health for the poorest communities. If you like this video, please consider watching one of my other videos here on the screen, and don't forget to hit the thumbs up and subscribe. Thank you so much for watching, and I'll see you in the next video.